Is it possible to relieve some of that pain by working on their like quads and legs and then the rest of their back?
Yes.
So like I know it won't I know it won't alleviate all of the pain, but will it help significantly, or will it just be like 10% better or 5% better, or
I
just
have no
depends
idea
on
how
the
much
person?
better it will be, but you can make the argument that the majority of the work that you do to relieve a lower back has nothing to do with the spot that's hurting. So what I
Right.
mean by that is you could argue that it would have you could argue that it's more important you be able to work the rest of the back and the legs and the hips than it is to work the exact spot of their back that's hurting them,
Okay.
right?
I see.
Because guys, where you're hurting is just where the the area is inflamed enough or tight enough to pinch a nerve. But that doesn't mean that that's the problem. In fact, we live in a world, I'm guilty of this too, by the way, we live in a world where we tend to blame symptoms or deal with symptoms, right? So we do this with physical stuff, where somebody's like, well, that the problem is where the pain is. Well, that's probably not true. Mr. Penrod gave us a great example right now. He said his back was hurting, and he could have kind of blamed everything just on his back, but instead he was like, maybe I need to be working out and doing these other things. And so he got kind of to the source, and we see this too, like somebody arrives late at work and they're like, oh, the traffic was terrible. Well, yeah, but traffic's always terrible. You didn't get up early enough. And you didn't get up early enough because you were partying last night, which is totally cool. But like, it's a chain reaction. You're just telling me about the symptom. And so, yeah, Mr. Kachekian, often you don't have to work on the direct symptom. In fact, the only reason I rub direct symptoms is it does give them some relief, like immediately. And it's natural, right? If I hurt here, it's natural to rub this area. And so when a client does let me work on an area that's bothering them, I do work on the area that's bothering them first because it just gives them some instant relief. Like when their neck hurts, I'm like, of course, I work on your neck first. But then I start to try to figure out, like, why is your neck hurting? And it may have nothing to do with your neck. Yeah. So the answer is yeah. I don't really need that one little spot that badly. Any other? These are great questions. Any? Miss Tops, please.
Is there anything that we should know about, like, emotional trigger points?
Yeah, I need you to define your question more.
So, I have a, she knows what I'm talking about too. But she told me, I had a friend, I'll say, she told me a situation where she was massaging someone and she got to, like, her arm and she was, like, holding her wrist. But it triggered her client because her client had certain situations, that had to do with her wrist.
That's what I thought you meant.
So I really don't know how to approach that, handle that, if we have to stop the massage. Can we talk about something before? Like, hey, if I touch an area, can you put an arm up or something so I kind of know?
Yeah. So thank you for asking. So just to rephrase your question, make sure I'm talking about the same thing and to kind of clarify for everybody. Bodies definitely have a memory, right? They remember trauma. And I think you're kind of talking about that, right?
Yes.
Okay. So bodies remember trauma. And if that seems, for many of you, that won't seem like a far-fetched thing, but if it seems like a far-fetched thing, just think also about little things like when you've hurt yourself before, maybe you've hurt a knee or an elbow and you kind of babied it. And then long after it was better, you still kind of baby that thing. That's remembering trauma too. Now we're talking about more severe things here where somebody's been abused. But bodies remember trauma and people remember places that they were touched in trauma situations. And so you can often inadvertently, accidentally, you're just doing your massage and you grab somebody's wrist and they've had their wrist grabbed when they were abused. Or, by the way, there's also subtler things too. You rub somebody's abdominals and they feel very self-conscious about their abdominals, and that sets them off emotionally or whatever. Anyway, you're not going to know that unless the client tells you, right? You're not going to know to avoid those areas ahead of time unless the client tells you. And this is, by the way, I said when I do push an issue, I only push it once. Because the person telling me not to touch their glutes, tying this back to Ms. Cupage's comments, might be telling me not to touch their glutes for other reasons, right? So once I've asked twice, that's it, right? Once I push that issue, I let it go because they might not want to discuss the trauma. And that's fine too. But let's talk about what happens when you've triggered a client. Or they become triggered. I don't even know who's to blame. This will happen a lot, and it will also happen just spontaneously, where you're just massaging along, has nothing to do with where you're massaging, and the person starts crying. That will happen a lot to you. I don't even know if you've had that experience before. Sometimes I get a massage that's so good, and I get so relaxed that I kind of feel kind of weepy. You know, I'm just like, so nice to be relaxed. So anyway, this is common. And what I always do, the first thing I ask the client is, I say, would you like me to continue massaging or to stop? I ask them. I would say like 80% of the time, maybe more, they say keep massaging. Just avoid that area, or keep massaging and don't avoid that area because it has nothing to do with that area. You know, a lot of people are like, no, it's just something I'm going through, and that's it. And I keep going. Because this will happen pretty commonly. Then if they do say stop, and I have had people say, I need you to stop, then I ask my second question. Do you want me to sit here with you, or would you like me to leave? And I say it calm like that. Yeah. And I've had people ask both. Usually they ask me to stay. And I just sit there with them. And we're not counselors. We're not therapists, and you're not licensed to do this. But the thing that you can do that's extremely helpful for people is you can mirror them and you can bear witness for them. And these are very powerful things that are very misunderstood. Mirroring just means I say, so, Ms. Tops, you're saying what happens when somebody is emotionally triggered, let's say if you grab their wrist. I didn't add anything to the conversation. I just made sure that I understood what she said and that she heard what she said. That's mirroring. So I'm hearing what you're saying is that like the massage brought up all sorts of feelings about like losses in your childhood and stuff, if this is what they're saying. And they go, yeah. I don't comment on that. Please don't be arrogant enough to think that you actually have something of value to say to that. I don't mean because we suck, but I just meant really. The chance that I know enough about you to really add to that, very unlikely. But I can be there. The other thing you can do is if somebody's not talking, is to kind of bear witness to their feelings. And what I mean by that is you just sit with them in where they're at. And it reminds me of, it's much more helpful than you realize. You're kind of sitting there with them as a fellow human being and just being there with them. And it reminds me of a beautiful story that I don't remember who it came from. Could be this guy Leo Buscaglia, but it could be somebody else. But it's a story, and there's this neighbor next door whose husband dies, and the little kid goes over to see the neighbor. The kid's like 4 years old or whatever, and sits with the neighbor and stuff like that. And the kid comes back, and the mom says, you know, what did you do when you were over there? And they said, I just sat with them and helped them cry. I don't mean that you have to cry with your client, but I meant you're just sitting there and helping them grieve by being there. It's just a beautiful, beautiful thing. And it's an honor. So I ask them, do you want me to continue to massage? They usually say yes, and this doesn't even go any further. They say no. I say, do you want me to stay or go? They usually ask me to stay. We stay for a while, and sometimes they ask me to start the massage again. Sometimes they just thank me. I've never had them even not pay for the session. They thank me, pay for the session. I see them again. If they ask me to leave, I do that too. I've always had them pay for those sessions too. I don't know if I would care if they didn't because it's so rare, but I mean, I've just never had a problem with this at all, but I ask them. Sorry for that very long answer, but that was a very important question because it will come up. And because as much as we care about structural massage and all this stuff, massage is first and foremost, always first and foremost, human beings massaging human beings. And it is an emotional thing, period. If we forget that for a second, you're in the wrong place. It is completely. In fact, you can be a mediocre massage therapist, but a great people person, and you're going to be a great massage therapist. You can be a phenomenal structural deep tissue person and not good with people, and you're going to stink. Sorry.
Thank you.
Yeah, thank you. Any other deep probing questions, Miss Cuppage?
Okay, so people come into massage and they want to chit chat. Some people just want it to be quiet.
Yeah.
But I also am wondering, like, we have all become pretty familiar with each other, in class.
Yeah.
And the people that we're maybe practicing on we're familiar with. So it's easy to chit-chat. But my question is, do you suggest, like, how are you doing today? Is there on the table and starting up conversation? Or do you just wait until they initiate that?
Yeah, thank you. This is a great question, too. Listen very carefully because it's not just that they want to talk or they don't want to talk. Sometimes they want both. In fact, quite commonly they do, and let me explain what I mean by that. So a lot of clients come in. By the way, I don't think you should initiate conversation. The short answer is do not initiate conversation because it's their time. Now, I initiate things like, gosh, does this bruise hurt? Do you want more or less pressure? But I don't, once they're on the table, I don't ask them how they're doing today. It's fine, by the way, if you have a cordial, how are you doing today on the table? I mean, that's not a big deal, but that's it. I do not initiate conversation. That does not mean that I don't have some clients that we talk the entire time. That's common, but I don't initiate it. But here's what I mean by some clients want to do both. Many people talk because they're nervous and because they're trying to be respectful. So they don't want to treat you like a servant, so they talk to you a little bit. They ask how you're doing. How are your kids doing? How's your day doing? Is this, you must be tired. It's the end of your day. That kind of stuff. By which is true, by the way. When it is the end of your day, you are tired, but that's not what you say. I always say, actually, you're my last massage of the day, so I don't have any more after that, so I don't actually feel tired at all. This is probably the best massage I'm going to give all day. I'm never tired. Outwardly. Never. Because I don't want them to feel guilty while they're on the table. Right? They're paying for this. I don't want my waiter to come up and be like, oh, man. You know what I mean? Like I care.
Last table. So sick of doing this today.
Yeah. So, no, I'm always like, nope, I feel great. You're my last client. Actually, these are my best massages. Yeah. And the first one of the day, I got to worry about the other 5 I got to do, but you're going to get the best massage. So anyway, they talk and they make conversation, and then they actually want it to stop. Because now they've kind of checked in, they've done the polite thing, and they're done. So here's the problem, though, that we all fall prey to. This is the part I want you to pay attention to. Polite people, you can keep the conversation going and not realize that you're the one keeping it going. And I've had this complaint before at the Princess on multiple occasions, where the person's like, the massage therapist talked the whole time. The massage therapist, like, they kept talking to me. And the person was like, they kept engaging me and I was trying to be polite. Right? If I keep asking you questions, Miss Cuppage, you're a nice person. You're going to keep going, yeah, we did that. We took that trip too. Or, yeah, my dogs are like that too. And then I keep leading the conversation on. So I do a couple things. One is I don't initiate conversation. I do engage in it wholeheartedly if you want to talk. I love talking. And then I let it die at least 3 times during the massage. And how do you let a conversation die?
Stop talking.
Oh, thank you for initiating the conversation again, Ms. Cuppage. Because actually, to make that point, I would have sat there until somebody talked. And then I will chat with you again. You've just reinitiated, right? And we'll chat for a little while. But after about 10 minutes, just to make sure
Makes sense.
Ooh, thank you. I'm so glad you said something. Thank you. Because honestly, that would be the rest of the massage. And that would have been the rest of class, had you not said something. To make my point. Yeah. So let the conversation die, because what happens is people, you got to remember, not only is this person polite, they are naked on a table. They just don't feel in the position to be like, hey, I don't feel like talking right now.
Yeah.
Yep. And when we get clients like that, I've had therapists come out and they're like, my client's kind of rude. They just told me they don't want to talk anymore. I'm like, be thankful, because those clients don't complain. Mm-hmm. Nice people complain to the manager when you're not around. Nice people don't come back. Like me and my wife, we're nice. And when we go to a restaurant, we don't like the service, we don't complain, we just never go back. They can't fix it. We don't give them an opportunity. And that's actually not really cool. It'd be better if we were a little bit bitchy and gave them an opportunity to fix what's wrong. Right? So you actually want kind of clients that are like, hey, I don't want to talk anymore, and you need to go deeper there. My favorite clients, I'm generalizing here, but my favorite clients used to come from New York. And they come in and they're like, Yeah, my low backs come in. I don't care what else you do today. Please get on that a little bit. And I'd be like working along. Could you go deeper there? Absolutely. And I'm like, this person's kind of abrupt. They walk out of the room. Here's $40. Thanks. Good job. Best clients ever. You want people to speak up. Please make sure that when you ask them questions, you really want to hear the answers. When I ask more or less pressure, don't be like, so do you want more or less pressure? That tone of your voice just told me you don't want to hear the answer. Right? I'm like, hey, do you want more or less pressure? Well, if you don't mind, I don't mind at all. I don't mind whatever. I want to know. Yeah.
I found too with that more, do you want more or less pressure? It's like, you want more pressure, but maybe now it's like, is this the right pressure? Like to recheck, because sometimes then it's like, oh, I went too hard or didn't go hard enough. So I kind of find that saying it once isn't really enough.
No. I try to say, do you want more or less pressure until I get that's pretty perfect from you. I literally want to hear the word perfect.
Yeah.
And then I have to make guesses and adjust for the rest of the massage. Don't keep asking every new body part, is this more or less pressure? Because that does become...
Do that?
No, I don't do that because because the person doesn't want to talk to me 47 times and answer that question. And that's a nervous habit. Once I figure out the pressure, I usually start on your back. Then I know that your inner thigh is going to take way less than that, right? Like I make kind of normal adjustments. If you jump or do something, I go, hey, should I be going a little lighter, a little deeper, or whatever? Then I'll check in. But if you don't say anything, I try to guesstimate from that point on.
Okay.
And I'm also trying to figure out your personality type. So, like, you guys all, I actually know some of you, because I've worked on you briefly. Some of you, also, it's not just about the pressure being right, but I also know which way it should go. So what I mean is, some of you love to be beat up, like me. And so, once I get the pressure right, I know when in doubt, go deeper. Right? You're never, and you'll tell me to back off, but you'll never be mad that I went ham on something. You know what I mean? Right? You love it. You love it. I don't mind when a massage therapist goes too deep on me because I'll just be like, whoa, but I'm glad, right? And then I have other people who are like, I'm pretty sensitive, and that's totally cool too. I know when in doubt with them when I'm on a new part, and I'm kind of like, I'm not quite sure. Tone it down a little bit for that part. So I'm trying to figure out your personality type too. Are you a deep fit tissue fanatic? And then, so if then I find your pressure, do you want more or less pressure? Do you want more or less pressure? Okay, that's perfect, good. Then I guesstimate the rest, but I figure out your personality type. Like, when I guesstimate, should I guesstimate high or low, basically. And that really has worked very well for me, assuming you don't get other signals and stuff. I also tend to err on the side of going too heavy in general because I find people are more likely to speak up when you're going too heavy than when you're going too light. They don't mind, except guys. Sometimes guys are a little macho, and they're like flexing and stuff. I'm like, should we go a little bit lighter? No, it's good! It's good! Really? Because, yeah. But most people will tell you something hurts. What they won't tell you is to work harder. Right? I'm like 230 pounds, and if you're working on me, Ms. Cuppage, I feel kind of bad when I'm like, hey, could you go deeper? Because I'm like, poor lady. Like, you know what I mean? Yeah. Which is what's going to happen, by the way, when we do our experiment. I'm going to be like, you need to go deeper. It's coming. It's coming like freight train. So, but you do feel bad, you know? So anyway, that's what I do.
Thank you.
Thank you. Miss Mitchell.
So when we start clinic, if we have a pregnant client come in, I understand, like, we have them lay on their side. We haven't done side lying yet. Like, do you have them lay on one side, then have them lay on the other side, or how does that work?
Yes. By the way, I'm sorry, the reason I was laughing was usually we know before they come in. They reach out to us, and I come to one of you and say, hey, do you feel comfortable at this point in the game doing it? And if you're like, nah, I'm not feeling it. Whereas some people are like, yeah, bring it on. Usually women that have been pregnant before are like, yeah, whatever, bring them on. But anyway, yes, we would go side to side, and we need to practice that beforehand. So 2 answers. One is you're probably not going to get that surprise because we know ahead of time. They check in, and we'll talk to you and make sure that's a right fit for you. But secondly is you have them lay on their left side and then their right side, or the right side and their left side. And instead of working front and back, you're working left and right. Or right and left. I mean, I realize I horribly oversimplified things, but that is the truth. right? It's just weird because you're like, that means I work this half of the back, kind of going up the side. Yeah, you do. You really do. And you do wing it. You really do. I don't mean you don't get better at it and things like that, but it's just a different way to approach a body. There are some advantages to sideline, by the way, everybody. Even if somebody's not pregnant, I know some therapists that do all their massage in what's called sideline or sideline positions, same thing, because it gives you massive access to shoulders and hips because they're right there. And so you can sit there and manipulate the shoulder and the hip really well. And so some people prefer doing massage that way. I know a woman who does all her massage sidelining. She's like, I like putting people in a fetal position too. She said, I think they feel more comfortable. You know, I by the way think she's probably 100% right. The problem was I was trained 28 years ago to do front and back or back and front, and it's kind of hard for me to switch it up. But I've done it. Yeah, and it is a nice thing to play with in lab, and you don't need training to play with it. You just play with it. Get your partner, try to do a massage sideline. I mean, very respectfully, many of you need to start getting out of your comfort zone. I'm talking to almost all of you. Like, you're doing an awful lot of back work and no front work. You're not doing work with them on their side. You're not doing things, and they're going to come up in clinic. And they're going to come up in the real world. And I will say this to you, I've said it to every class. If you won't do it in lab in a free massage, you won't try it in a pain massage. If you're afraid to do it on your partner who doesn't care in school, you won't do it when you're doing a $100 massage, and your massage will never grow. So right now, try to make things difficult on yourself. It's like going to the gym. When you go to the gym, do you just walk in there and pick up the light weights? No, you're there to challenge yourself. You know that if you don't, and when you think you've had a good workout, you walk out, you're like, oh, good workout today. Yeah, you feel good about that, right? I want you to walk out of lab and be like, wow, did I suck today? That is a very good day in lab. If you feel you sucked, it's because you put yourself in a sucky situation. You tried to work their back when they were face up, and it can be done. You tried to do the entire massage face up. If you're walking out of lab and you're like, I did a really good job on the back, congratulations, you and every other massage therapist in the world. I'm sorry to be so blunt, but not going to get you anywhere. Do legs and arms effectively. Almost no therapist can do those. Work somebody when they're entirely face up for the entire session. You're going to see this coming in lab too, by the way, where we have you work on feet for the entire time. And people just lose their mind. What am I going to do? Figure it out. Because you will have clients come in too. And I have had many clients come in. I used to have a woman come in from New York, get a 2-hour massage, and all she did was feet, hands, head, and neck. 2 hours. And she was one of those New Yorkers. Boom. Loved her. She laid on her back the entire time, and we did feet, hands, head, and neck. And you can't sit there and do this. You got to get in there. You got to make it memorable. And the way you do that is you just dig in there. So please challenge yourself. I want you guys to do crappy massages because you're challenging yourself. I don't want you to do good ones. Yeah. I know that sounds crazy, but I want it to be like the gym. I want you to walk out exhausted and failing. You know, it's one of the hard things we do in the gym too with people is they're like, how long should I lift this weight until you can't lift anymore? And people are like, so I'm supposed to go to failure. Yes, you're supposed to fail. Put yourself in a failure situation. I don't want you to be successful. And that sounds really weird because then everything's easy later on. Make yourself fail. Mr. Kachekian, you had your hand up and then I talked so long you took it back down again. You gave up.
No, I forgot my question. I apologize.
That's my new teaching method. I just go on and on until you forget. All right. Cool. Sorry, by the way, not cool you forgot your question, by the way. It'll come back to you. Any other questions before we now take our break because I've talked so long? But I'm actually really glad we talked about this stuff because this is the stuff that matters in the treatment room. Yeah? Well, it's a preview of coming attractions, so. Mr. Kachekian, came back to you.
Yes, it came back to me. So, you were talking about, like, when you're massaging somebody and communicating with them, like, talking with them during the massage or not talking with them. Is it about 50-50 with people? Like half of the clients want to talk and half of them don't, or it just depends? It's not, you can't really distinguish it.
I think 50-50 might be a good guess. But it's been so long, I remember. But I maybe 50-50. Yeah. In clinic, by the way, we really try to discourage it because what do you guys have between your bays? Do you have a wall? No. And so you can hear the massage therapist and client 5 bays down having a conversation. So actually in clinic, I'm always like, hey, we need to try to avoid talking so that, so that we don't bother the other clients. There's only so much control you have over that. But we call that spa voice, by the way, everybody, what I just did there. It's called spa voice. And what I do is when I come out to the lobby and I meet you, I say, hi, Mr. Kachekian, my name's Mike. I have the pleasure of being your massage therapist today. Any major medical stuff I should know about? Nope. Anything we're focusing on today? Oh, neck and shoulders. Now, are you here that the whole session should be around neck and shoulders? Like, I'm not going to work just on your neck and shoulders, but only things that relate to that might not get to your legs, for example. Or do you want a full body and you want a little extra time on your neck and shoulders? Full body, a little extra time on your neck and shoulders. Cool. Let's get going. And then we walk through the door. Okay, Mr. Kachekian, so I'm going to take you back to the bay. And me lowering my voice like that, instantly, people pick up social cues pretty good. All of a sudden, Mr. Kachekian's like, oh, okay. We're in a quiet space right now. Yeah. So you set that tone, too. But anyway, yeah, I think 50-50 is a good guess. Who knows?
Thank you.
All right, everybody, let's take a breaky till 9:17, and then I promise we will come back and talk about the breathing muscles. We have plenty of time. 9:17. We need to talk about breathing. And this session is being taped. Actually, I taped most of what we talked about before this session, too, just in case, whatever. But let's talk about breathing and why it's important, and even how it ties into yesterday's lecture, and how it will tie into, I don't think you guys have done the lungs yet, but really they could have been included with the cardio system, cardiovascular system. So yesterday, you all learned about the heart, and the day before that too, right? And really the important stuff to really remember about the heart is why you have one and the basics of what it does. I understand you learned about like tricuspid valves and bicuspid valves and stuff like that, but you'll never, ever once in your massage be like, I need to know that the bicuspid valve is between the left aorta and left ventricle or something like that. It's just ridiculous. But what you do need to know is that the heart is a 4-chambered pump, right, that rests right here. People think it's a little bit to the left. It's not. It's just that the left ventricle is a little bit bigger. So it's kind of skitty-wampus. It's kind of bigger on one side than the other, but it's really centered in your chest here. It's a 4-chambered pump about the size of your fist. This is leading to today's lecture, by the way. I'm tying it all together here. And that any tubes coming out of that heart are called arteries. And the main one that comes out the top of it that's about the size of a garden hose, you could stick your thumb in it, is your aorta. And that tube then has all these smaller tubes branch off it, and smaller tubes branch off it, and smaller tubes branch off it, and all that kind of stuff, right? And it goes out to every single area of your body, down to little capillaries. And I showed you guys a picture a while ago of capillaries, right? Where the whole body was just covered in them. And those capillaries get so small they get down to 1 cell thickness, and they leak. The arteries don't leak, but when they get down that thin, they leak. And they literally leak like a drip irrigation system into the soil of the tissue of your body. And that means all your cells are floating kind of in blood and plasma, which is just the water in blood. And those cells, because it's not like an artery goes straight or a capillary goes straight into the cell, it doesn't. It waters the tissue around it. And then the cells literally open up their walls. They use a way of transporting materials through, but for all practical purposes, they open up their walls and they pull in nutrients they need. That's where they get their oxygen for burning ATP. the powerhouse of the cell, and they bring in nutrients, proteins, and things like that to operate and everything they need to operate. And then they also open back up the walls and throw out their trash. CO2 is a byproduct from burning the ATP and other trash that they don't need. And the other capillaries slowly, they absorb back in them, they pick it up and they bring it into your cardiovascular system. They release the CO2 out through your lungs, out to the world. The lungs pick up new oxygen. It gets picked up by the heart and starts the whole process over again. Right? And the arteries are taking this oxygen-rich blood away from the heart, and the veins are bringing this oxygen-depleted blood, this CO2-rich blood, back to the heart. And without that, your cells die. And if enough cells die, you die. And that's it. It's that simple, or that complex. So blood is life, and you could also argue breath is life, because when I breathe in like this, my lungs are filling up with air. There's a whole bunch of tiny sacs in your lungs that have so much surface area that if you spread out my lungs, I know they're only this big in my body, but if you spread them out with all those little sacs and open it all up, it would cover a tennis court. What? Yes, it would cover the roof of your house. That's how much surface area it has. And that's designed to let the oxygen that I just breathed in mingle with the capillaries that are going to go back to my heart, release the CO2 for them, pick up oxygen from them, go back to my heart and get pumped around the body. Why is this important? It's because you do this in a chemical way and a car does this in a different way, but very much like a car, the lungs are the carburetor for your body. So, for those of you who don't know how a car works, a car takes gasoline, it takes air through a carburetor or turbocharger or whatever, it mixes the gasoline and air together, a spark plug lights them, it literally blows up, pushes a piston down, and that piston makes your wheels go. Slightly oversimplifying, but that's how a car works. It works by millions of little explosions going bam, 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 and it does that by mixing gas and air together.
I love how you explain that. That is the first time it's ever made sense.
Oh, good. Good. That's exactly what a car does, by the way. There's some other stuff that help it do it better, but that's it. But if you ever talk to a really good mechanic who's trying to figure out the problem of a car, they try to figure out if it's not getting gas, if it's not getting air, or if it's not getting spark to light the gas in the air. That's how they really do try to solve problems in your engine. So they trace those things down because it's generally one of those things. Your body does the same stuff. It can't operate very long without oxygen because it needs oxygen to efficiently burn ATP and to make your cells work. So your body very much needs oxygen to make its explosions happen. Now, it's not pushing a piston down. It's running a chemical reaction, but it's still the same concept. And the reason people get all excited about a turbocharger on their car, like a lot of us are like, well, it's turbocharged, right? We know that makes it go faster, but we don't know why. A turbocharger just shoves more air into your engine. And more air mixed with more gas efficiently makes for better explosions. You're the same way. When you guys are at the gym, right? Or you're running to catch a bus or running after your child, right? Do you notice you start to go, you're doing that because you're burning more energy and you need more oxygen, just like a car to burn more energy. So breath really is life. So this really is my carburetor, these lungs. And the more efficient I am at breathing, and the more efficient my heart is at pumping that oxygen around, those two things together, it has a lot to do with how efficient an athlete I am. So with the cardiovascular system, one of the things that makes it really efficient is if your tubes are really clean. Because if the tubing in your cardiovascular system starts to shrink down, that's what really causes high blood pressure. Yes, there are things I can do to raise my blood pressure, like you can scare me, for example. That puts my blood pressure up temporarily. But smaller tubes make higher pressure. And so things like cholesterol buildup inside your tubes makes your tubes smaller, and that drives your pressure up. And that means your heart has to work harder to get enough blood through to your muscles that they need. That's really high blood pressure when it comes to chronic high blood pressure. All of you have high blood pressure from time to time, and you want high blood pressure from time to time. When you're running, your blood pressure goes up. You want it to. We just don't want it to be high when you're resting, so your body gets a break. Bodies do very well with stress, everybody. They don't do well with stress without rest. They like to stress, they like to rest. We do the same thing in class, right? I want you to stress yourself in lab, try some challenging stuff, and then relax and get a massage. Give a challenging massage, get a relaxing massage, stress and rest. Same thing with your cardiovascular system. So, anyway, my efficiency of getting air into my body and being able to pump it around my body to get to all my cells really has a lot to do with athletic performance. And by the way, you don't have to be an athlete. It has a lot to do with how well I feel when I walk up a flight of stairs. So, what we're doing today is very important because we're going to look at the things that might inhibit, make it harder to breathe. Because we are going to have clients come to us, and if these certain muscles are tight, they might actually be having a hard time breathing. And just like a car, if you guys can try this right now. Stick a straw in your mouth and go run around for a minute. See how well you do with that. Don't do it too long because you'll pass out. Because you won't be getting enough air in to fire the engine. Right? You can do this in a car too, in a reverse way. You can stick a potato in the exhaust pipe. We used to do this as kids. We were bad kids. It doesn't hurt the car, by the way. You stick a potato in the exhaust pipe and it can't suck air through, right? Because there's no air coming out. And so the person can't start their car, right? But it doesn't really damage it. They're bad teenagers. Anyway. Oh yeah. Oh, this is mild. Trust me, the potato's mild. Anyway, so but you get people you don't like, you put a potato in there. It's so funny because they look at everything up front before they ever look at the exhaust pipe for the potato. You know. And they're really easy to get out. You just take a little corkscrew and pop out the potato and the car just drives right off. Yeah. Okay, so anyway, very unimportant side note there. So the point is we're going to have clients come to us with constricted breathing, and so that's really important. And whether they're athletes that want as much lung capacity as they can have, or just an ordinary person whose tension is causing them to not have as much lung capacity as they can have, we care about that. And here's one of the reasons we really care about, like, let's just say a non-athlete who's having breathing problems related to tension. Unconsciously, if you're having slight breathing problems, I'm just talking about little ones, like let's say your breathing is depressed by 20%. So you're not breathing through a straw, you're breathing through something slightly bigger. You don't really even notice it until you're going upstairs or something. And you don't know that your breathing is reduced, right? Because it's just a small little amount. But if you're feeling anxiety and you're having a slight problem breathing, what do you think that does for your anxiety? Thank you, Ms. Smith. It increases your anxiety. And that makes your tension worse, which inhibits your breathing, which makes your anxiety worse, which increases your tension, which inhibits your breathing, which makes your anxiety worse. I hope you can see where I'm going with this, because my arm can only go up so high. Right? We look for cycles in massage. We talked about pain cycles, where somebody is in pain, they tighten up, which causes them more pain, actually, and they tighten up more, causes more. This is the same thing. So we do care about breathing, because when people breathe well, they relax well. And when the opposite happens, their actual tension created by not breathing usually causes it to make it even harder to breathe. That's why we're going to care about this. So, yes, Mr. Kachekian.
Is this related to vasodilation and vasoconstriction?
Sure, I mean, kind of. So vasodilation and vasoconstriction is something that your body does all the time, which is really, really amazing. And that is that the plumbing in your house you're stuck with. So all of you in your house or your apartment or whatever probably have some sink that runs really good, and the water comes flying out of it, and some shower that doesn't, or something like that. And there's nothing you can do about it, because it has to do with the size of the pipes going to those things and where the pipes are in line with the other pipes, things like that. And if you're not going to replace the plumbing, you can forget about it, right? Your body actually has some really cool things it can do. your body can reduce blood flow by actually reducing the pipe size of your arteries to areas that don't need it, and increase the the pipe size to areas that do, because your arteries are all covered by muscle. They have smooth muscle around them, and that smooth muscle can really contract and actually close down arteries or let them open up. This is very important. So if you get scared and start running away from a dangerous situation, your body will open up all the arteries to your legs for sure, but probably your arms as well. And believe it or not, to your eyes and things like that, so your eyesight's really good. And it will start to constrict the arteries going to your stomach, liver, because you don't need to digest right now because you're trying to get away from something harming you. So it's your body's way of making sure blood gets to the important areas of your body. Sometimes if you guys notice that you're feeling a little bit cold, but your hands are super cold, that's your body being smart. It knows that if you don't keep this area roughly at 98 degrees, you die. It's over. You drop more than about 5 degrees in here and some really bad stuff starts to happen, especially in this whole area. But my arms, they can drop 30 degrees and come right back online. They're fine. So when my body notices I'm getting cold, the first thing it does is actually, it doesn't think, oh, I want to warm up this guy's hands. It's like, I want to quit sending blood out there, because that blood keeps getting cooled down out here and I got to keep this area cold. So it doesn't shut down, but it reduces blood flow to my extremity that I'm not using, to keep all the nice warm blood in here. So that's vasodilation and vasoconstriction. And your body does it automatically. Yes. There are some vasodilators that some people take, like if they have heart problems, to help open up their arteries and things like that. But yeah, that's how it relates, sir. Okay. So, before I show you slides of breathing muscles and such, there is only one main breathing muscle. There are lots of non-main ones that we're going to get to. Don't misquote me. You use more than one muscle to breathe at times, but there is only one main breathing muscle, and probably everybody here right now, including myself, is only using this muscle right now. The other ones only kick in when we need extra power, and that is your diaphragm. Your diaphragm is your main breathing muscle, and when you are at rest, by the way, it's always your breathing muscle. It's always helping you breathe. But when you're at rest like now, it's probably your only breathing muscle. So it is an umbrella or mushroom-shaped muscle inside your chest. This is very hard to see from the book. I will show you slides, but I want to show you in a skeleton. It really is a muscle that is inside the rib cage. It hooks to the inside of the rib and the inside of the back here, the inside of the vertebrae, the anterior surface of the vertebrae, and it goes around the sides, and it's a dome shape. It's an umbrella. It really looks like an umbrella or a mushroom cap in here. And if you think about it, where's my tape? Definitely need tape for this. Hold on. And at rest, you have breathed out. It actually takes effort to breathe in. It doesn't take effort to breathe out while you're resting. So all of you have to try to do this. You don't have to try to do this. That's just the natural elasticity of my ribs pulling back down in. You can breathe out hard. You can make that happen faster. But my point is, the effort of the diaphragm is actually in breathing in. And here's why. Muscles can only do one thing. What?
Contract.
Thank you, sir. They can only contract. And contract means to what? What happens when they contract? Do they get longer or shorter? What? Shorter.
Shorter.
So if I have a dome-shaped muscle in my chest, and it contracts, it will flatten because it gets shorter. Now, I move my hands apart to get this. My point is, if this tape shortened, it would get flat. Yes, Miss Smith, thank you. So what Miss Smith did, it does this when it contracts. Now, what does that do? Well, I've got lungs on top of this. by the way, the lungs are wrapped in a sac, and this muscle is attached to that sac. But when it pulls down like this, it creates a vacuum. It's pulling on these balloons. And when you create a vacuum, air rushes in. And I don't want to get into all the science of this, but what you guys don't realize, because you're fish in water, like if you go to a fish and say, hey, did you know you're in water? The fish would be like, what are you talking about? I don't know what water is. This is just where I live. You guys forget you live in air. So there is thousands of pounds of atmospheric pressure pushing down on you right now. The only reason you don't feel it is it's also inside you. So it's equalized. But if I create a vacuum in here where I pull something down and there's lack of air, air rushes in. That's how a vacuum works. Air wants to fill up the vacuum. So when this guy comes down like this, it makes more room in my chest cavity, air rushes in. So my diaphragm contracts and I inhale. And then I just relax and my ribs have enough elasticity that it goes and I exhale. And you essentially do that from the day you're born to the day you die. And it is under your autonomic nervous system. However, you can take over automatic control. I mean, you can take over conscious control of it if you need to, until you pass out. And then it becomes automatic again. So basically, everybody that passes out starts breathing again, because it's an automatic function. Now, because breath is life, because breath is one of the main things your cells need to have energy, and we don't think, by the way, not just energy so you can run up a hill, energy so they can produce the proteins that repair the problems in your body, energy so they can produce white blood cells to go fight foreign invaders. Energy. So not just energy for like, yeah, I need energy today, we're going to a party. Energy to make sure you stay healthy. So oxygen really is life. And so this process is very important. And when muscles are oxygen starved, they not only not perform very well, they tend to get tense and tight and they don't work very well. So you can get a lot of tension. So if I'm having a hard time breathing, it might even affect the very diaphragm that's helping me breathe, right? The diaphragm needs air too. The diaphragm is helping you breathe in the very air that the heart will eventually bring to the diaphragm. Like, this is a very important relationship. And that is your main breathing muscle. This is the one that's always working. Now, you have other muscles that can help you breathe when you need to breathe more. So my diaphragm's fine when I'm sitting here talking to you guys. I'm like, so guys, today we're going to talk about breathing. And breathing's really da-da-da-da-da. Okay. But when I'm running, I need a turbocharger. I want to get more air into the engine. And the way I do that is to breathe faster. I want to get more air in quicker. And by the way, I also want to get it out quicker. Because the quicker I get it out means the quicker I can have my next breath. It does me no good to breathe in fast. If I breathe out really slow while I'm running. No, I need to be like, and do you see what happened when I was doing that? My rib cage is moving fast. And so we have other muscles that help us do that. And I'm going to show you pictures of all these, but I just love to do overviews of where we're going so we have it in plain English. One of the other main breathing muscles that we only use when we need to breathe in and out fast, diaphragm still working, is what's called the intercostals. Does anybody remember what the word costals mean? Ribs, thank you. Costals mean ribs. And it's a good word to know, by the way, because you have costal cartilage. We have the iliocostalis, but it's the iliocostalis, right? Iliocostalis, costals, ribs. So you have your intercostals, which is the meat between your ribs. And you've got internal and external intercostals, which is very confusing. But between those ribs, you've got some meat that's on the inside and on the outside. And I literally mean, like, if I push between my ribs here, I'd be pushing on the external intercostals. If I reach underneath my ribs, which I can't do, but I push from the inside, I'd be touching internal intercostals. But I mean, visually, they just almost look like the same muscle. They're just your rib meat. And for my meat eaters out here, this is ribs. When you guys go eat ribs, you're eating intercostals. You're eating internal and external intercostals. And they run diagonal, just like your internal, external obliques. They run like diagonal. Flip over your ribs next time. You'll notice that the fibers run opposite directions. That is internal and external intercostals of a pig or a cow or whatever. That's what rib meat is. That meat was there to help them breathe. And that's what you have in your lungs. Now, your book will tell you, by the way, one helps you with inhalation, one helps you with exhalation. Jury's still out a little bit on that. But the point is they can help to at least pull your ribs together to help with a forceful inhalation. Your book thinks they can also probably help to raise your ribs depending on how they work together. And that's quite possible, too. I'm not arguing that completely. I'm just saying they're there to help with forceful contractions and expansions of your rib cage. So now when I need to breathe more, I can be like, now my diaphragm's working, boom, 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 and my intercostals and my internal, external intercostals, my rib meat, is also helping me expand and contract my ribs faster. In fact, sometimes they get tired and you get a stitch in your ribs. You ever felt that thing where you're like, I got a pain in my side? It's probably one of your intercostals cramping because it's working so hard. It might be working so hard not getting enough oxygen because it's going to other parts of your body, but it's trying to keep you breathing. Miss Smith.
So when you get short of breath, is that your diaphragm getting tired?
It could be. It could be, but it also could be that you have just reached your oxygen output maximum, right? Like short of breath, meaning like you can't pump it in fast enough for your level of fitness to get everything your body needs at that point. And that's it. And yes, that would cause your diaphragm to also get tired because it's now not getting enough oxygen too. But it also probably is just you reaching your maximum fitness level. You've gone past, your maximum. You can go past your maximum for a very brief period of time, but then you're out of breath. Yeah.
Right.
Yeah,
But
because
I
you're
guess
not.
I'm kind of thinking more along the lines of like distance runners. Like, can you like strengthen your diaphragm? I guess I mean, like the longer you're running, like your diaphragm is becoming stronger, and it can like physically get sore. Like glutes would get sore if I did the 100 squats.
Sure. That's not usually what seems to stop them, but absolutely your diaphragm gets stronger. A lot of athletes have bigger rib cage capacity. They're actually able to stretch their ribs open more because they practice without even trying. By the act of breathing hard, they're exercising their rib cage. Sometimes they even do exercises to get their rib cage bigger.
Don't snares too?
Yes. Try to do things to expand their lung capacity, because if you can get your rib cage bigger, essentially you're getting your lungs bigger. Essentially. And so yes. Yeah, it's very cool. But the other thing long distance runners and other people are experiencing too is that if they run out of their capacity at a certain point, they just can't get enough blood to those muscles, right? Not just their diaphragm, but their legs. And then the muscles fatigue. The muscles are like, I'm not getting enough oxygen in to burn ATP, and I can't do that very long. And so we're out of our range, yeah. That's why they sprint right at the end. They actually sprint out of their range at the end. They're going more than they have blood to do, and they can do that briefly. Your body can work without oxygen briefly, but not very long. Yeah. So those are your intercostals. And when you need to breathe faster and harder, you use those. And the whole idea is literally you're just you're turbocharging your engine. But you probably don't use those when you're just sitting here. There's no need. Also, let's talk about some other muscles before I show you pictures that you use too. Again, when you have to breathe really hard. Do you guys remember the muscle that attaches to the medial border of the scapula on the anterior side, runs around and inserts into the first 8 or 9 ribs here? I hope you do, because it's one of the top 5 most important muscles in the upper body. Thank God, thank you, yes. Okay, serratus anterior. So we know in anatomy, by the way, anytime somebody says anterior or superior, that there's always going to be an opposite somewhere, right? You have a serratus anterior that attaches to your scapula. You also have two serratus posterior muscles that don't have anything to do with your scapula, by the way. You've got a serratus, this is just rough, just to give you an idea. I'll show you a picture in a second. And these do not go to the scapula. I'm trying to get them to go to the ribs. They're really hard to see here. But you have kind of a serratus posterior, what's the word for up? Superior. And you have a serratus, oh, I did this wrong, by the way. No, I didn't. That's right. You have a serratus posterior, inferior, that hook from your spine to your ribs. I really should have used darker tape. But if I've got some muscles up top that go from my spine down to my ribs, what would happen if those muscles contract? What would happen to my ribs?
Go up.
Yeah, that's excellent, but we don't use the word go up, though, in anatomy. That is correct, though.
Elevate.
Elevate. And if I have these ones down low, and they contract, what would they do to my ribs? Depress. And in order to inhale, I need to elevate. Just watch me. You can actually see my ribs go up. I'm watching all you do. It's adorable. Your ribs go up. So your serratus, and you don't need to memorize this really, but your serratus posterior superior help you inhale when you need extra inhalation. And your serratus posterior inferior help you exhale. Again, this is when you need to do it quickly. So you're running from a bear. Bears are too cute. You're not running from a bear. You're running from a serial killer. I like bears. You're running from a serial killer. Jason, it's Friday the 13th, and you're running from him. And your diaphragm isn't enough. So your intercostals, your internal, external intercostals are helping to expand and contract your ribs faster. Your serratus posterior superior and posterior inferior are helping to expand and contract your ribs faster so that you can get away from Jason. I don't know why I went there. That's the point. That they help you do this extra when you need extra. Yeah? And that kind of sums up the main breathing muscles. The main breathing muscle is diaphragm. Yeah. In fact, have you ever heard paramedics say C3 through C5 keeps you alive? Well, it's kind of morbid, but it's true. I'm talking about cervical 3 through 5. Cervical 3 through 5 have nerve plexes that come out it. Yes, they feed your arm, but unfortunately they also go to feed your diaphragm. So if you break the neck between C3 and C5 and sever that nerve, by the way, don't worry every time you break your neck, but if you sever that nerve, you can't control your diaphragm anymore and you suffocate. So they'll say C3 through C5 keeps you alive. Miss Cup and Jess.
Like all the rest of the muscles, you can kind of like tear and have injury to, right?
Mm-hmm.
You can do a strain or muscle tear. Can you do that with your diaphragm?
I would guess no, but I've never read any research on it. Here's why I guess. I don't mean it can't be damaged. It's just like every other muscle and it can be damaged. But usually when you tear their muscles, it's because you've taken them too far. And I don't know how you take the diaphragm too far. Does that make sense? Like when I pull a hamstring, usually it's because I extended my leg too far. You know what I mean? Mm-hmm. I'm not saying you can't get a cramp in it. I'm not saying you can't exhaust it. I'm not saying that. But I think it'd be hard to tear. Tears usually come from overloading something with too much weight and stuff like that. I don't know how you do that to your diaphragm.
But how do you exhaust your diaphragm?
You don't usually exhaust your diaphragm. You usually can't get enough air into all the other muscles in your body to keep doing the activity you're doing. Your diaphragm is actually heavily It's highly vascular. So your body is really smart. Let me explain this a little bit better. Your body is really smart, and it realizes that if it can't get enough blood to your legs, you stop running, and that could be a problem. Could be. Big problem, especially if you're running from something. But if it can't get enough blood to your diaphragm, you stop breathing, and that's even a bigger problem. So you actually have better arteries and more blood flow going to your diaphragm than you do your legs, per the amount of muscle that's there. You've actually got massive stuff going to your legs, but your legs are massive. But my point is, your body makes sure to prioritize the blood to your own heart. Your heart's got a massive vascular system that it feeds itself, but it makes sure it feeds. In fact, that's what a heart attack is when the blood flow to the heart gets cut off and the heart muscle doesn't have air, and the heart muscle stops contracting in that area and the cells die. That's a heart attack. Anyway, your body does everything it can to avoid heart attacks and diaphragm attacks. And so those guys get priority. So it's very unlikely your diaphragm, it could happen, I guess, but it's very unlikely your diaphragm is getting exhausted. It's usually that you just can't pump enough oxygen and the rest of your body is getting exhausted. Yeah. Now, diaphragms do funky little things like hiccups. That is your diaphragm spasming.
My dad told me that I didn't breathe right when I was younger, so that's why I always got hiccups.
Yeah.
Which is weird.
Yeah.
He wasn't a doctor.
Yeah, not a doctor. I actually have no idea, but that is why, by the way, holding your breath sometimes helps. Because what you're doing is you're holding your diaphragm down in a position for a while to stop the spasm. And usually if you can hold it long enough, you're interrupting the spasm. So spasms have to do with like a little neuromuscular feedback kind of thing, and if you can stop it for a little while, they tend to go away. But anyway, so it can do that. It's a muscle. It's a muscle like any other muscle. Anyway, but it's got great blood flow. Your body really prioritizes the blood flow right in here and to your brain. Right? This is why people can lose an arm and a leg and they're okay, but you can't lose your head, lungs, heart. Like, you just can't, right? So anyway, it prioritizes that. You don't have to worry about that. So those are the main breathing muscles, which is the diaphragm, number one, have to have it, always working. Then you've got intercostals, internal, external, and you've got serratus posterior, superior, serratus posterior, inferior. And I'll show you slides in a second too, I really will. But I kind of like you to think about it. That said, there are a lot of people that argue that we have other breathing muscles that we do use. That, by the way, if you had to answer a test, and I'm not, by the way, setting you up for a test at the end of the year, I just meant what I just told you about so far is what most people consider the breathing muscles. Diaphragm's number one, that you should just answer that in your sleep. Diaphragm, breathing muscle. And then if people are like, well, there's other muscles involved when you're breathing hard. Okay, intercostals, internal, external intercostals, serratus posterior, superior, serratus posterior, inferior. That'd be the end of that answer. But many people theorize, and they're probably right, that there are other times when you really need to breathe really hard, that your body, because it's very intelligent, might even incorporate other muscles that might help you to expand or contract your rib cage faster. And at least one of them, well, actually many of them, are muscles that you guys know about. Does anybody want to guess other muscles that might help to expand or contract? I don't care which one. The rib cage, if you anchored it properly or used it properly. Your brain would do this for you unconsciously.
Your chest or like pec muscles?
Pec muscles? So...
Yeah, I don't know. Something like, because I know like your diaphragm and your chest and like your throat are like the three parts that you use to breathe.
I think if you're talking about a muscle that's attached to the rib cage, I think you're onto a very, very good path there, Ms. Stewart. I would like deeper explanation before I give you a correct answer, but I think that you are definitely on a very good answer there. You're working on that. I think there are other answers too.
I have to think about it.
Okay, think about it a little bit. You're definitely not wrong, by the way, Ms. Stewart. You're definitely not wrong. And she did, by the way, what I want you guys to do too, which is she's like, well, it's got to be attached to the chest. It's got to be attached to the ribs. Not the chest, but the ribs. Yes, Mr. McClure.
To expand the intercostals, is that the question, right?
To expand the ribs.
So if you bend
Or contract them.
backwards, what's that?
Or contract them quicker.
Well, your abdominals contract,
Yeah.
right? That would shorten
Yeah.
those muscles.
So we're
and
pretty
then
sure that your
your
which
spinae would.
that is actually possible. That was an answer I was not expecting from, with all due respect, from sophomores yet. That was actually very good. So the upper portions, your erector spinae, because your erector spinae, we talk about it as all one long muscle, but it doesn't have to work that way. So the upper portions of things like your, what's the erector spinae muscle that attaches to a lot of ribs? Wish we had one named like the ribs.
Iliocostalis?
Oh my God! That's so helpful too. Never even thought about that. The iliocostalis wraps around like this, and the upper portions of the iliocostalis can definitely, where they can pull the back down, it also means they can lift the ribs up. Because remember, muscles contract. We always think about like, remember I've said this 100 times, but I want you to think about it in many different ways. When I'm bending my arm to my elbow, this is the same as me bringing me over to my arm. To my elbow, this is the same. And so if I lock down the front of my body and don't let it go back, and I engage this muscle, it has to pull up my ribs. Because I'm not letting it do what it wants to do, which is go back. It wants to pull down my ribs, but I'm holding here, and so it's like, okay, if my brain's smart enough just to use, which it is, just to use the upper portions of my iliocostalis, it could help with an expansion of the rib cage. You will not see this on a test. You will not. This is just kind of like advanced. Let's start to really think about what it means when a muscle contracts, and we're starting to get into structural anatomy, right? Not just like my bicep bends my elbow. Great. That's nice. That was nice, 2 months ago, but yeah. So very good answer, sir. And then, of course, which of your abdominals, Mr. McClure? Since you mentioned abdominals.
The rectus abdominis.
Definitely rectus abdominis. I can see that right, because it attaches here. Its job is to do this, so it can pull down my ribs. Sure.
I can't remember the other names.
Internal and external obliques attach to my ribs and hook them down to my thing, so they probably help too. You've got a transverse abdominis that wraps around you like a belt. What does it do? It's like a giant sphincter muscle, by the way. What does it do when it contracts?
Hold it.
So it definitely helps with exhalation, if you need it to. These aren't perfect, but they can all join in together. So now you can have like 9 muscles helping you breathe out really fast or breathe in really fast, depending on what you're doing. So those are really good answers. Yep. And Miss Stewart, let me help steer you a little bit. Miss Stewart, if you had to pick one of the pec muscles, since you mentioned pecs, which I thought was brilliant, which one would be most likely to help, let's say, elevate your ribs?
The pec minor.
Yes. Thank you. Because, again, everybody, this is really important. I want you to think about this. I don't even care about it just to breathing. It's very important that you start to think about this because it will help you with structural anatomy. And this kind of separates the men from the boys, we always say. But the girls from the ladies, or ladies from girls. The pec minor is going from my shoulder down to my ribs. Normally my ribs, here's what really happens, by the way. When we started teaching you anatomy, we had to teach you very simply. So we taught you one muscle at a time, but your body doesn't work that way. So here's what really happens when my pec minor fires normally. My pec minor's job normally is to, let's say I'm doing something like a dip. A dip at the gym is me actually on a bar here like this, pushing myself up. It's mainly a tricep exercise and a pec major exercise. Right? My pec major is here, pulling my arm down. My tricep is extending my arm, allowing me to do a dip. I'm heading somewhere with this, so bear with me. So the exercise main power comes from my pec major, pulling my glenohumeral joint down, especially lower fibers of the pec major, and pulling my arm down, and my triceps extending my elbow so I can push myself down. But what happens is my scapula wants to fly off my back when this is happening. I got to pull my scapula down too, and what helps with that? Pec minor, right? pec minor definitely helps with that. So my pec minor pulls my shoulder to my ribs. And what it does when it's doing that, by the way, is my rectus abdominis and some other muscles make sure my ribs stay down here so they don't go up. And when the pec minor pulls, the ribs don't move and the shoulder comes down. Most things in your body are because your body stops something from happening to make sure this other thing comes to it. But what would happen if my rectus abdominis, as Mr. McClure just pointed out, helped me to exhale? It contracted, right? Pulled my ribs down and I went, whoosh. Now it let go. My trapezius kicked in, held my shoulder up, and my pec minor contracted. My shoulder can't come down. My ribs aren't being grounded anymore. My ribs come up to meet my shoulder. That's a lot. But that's actually how your body functions, that type of stuff. That's how you get all these different moves at little pec minor. And that's why it's a little bit confusing in your book, because your pec minor is like, the pec minor protracts or abducts the scapulothoracic joint and depresses the scapula. That's true. But if you anchor the shoulder, and they also don't tell you that you're usually anchoring your ribs for that to happen, because you don't want the ribs to move when you start pulling. But they don't tell you can do the opposite. That if the shoulder is anchored, which you anchor it with your traps and things like that, that it can elevate the ribs. And I think you already noticed nothing in your body is just doing one job. I mean, your bones don't just hold you up, right? Remember they store all those minerals and make white blood cells and make red blood cells on their spare time? Like everything in your body does multiple things. Mr. McClure, please.
So if you had a rigid or weak QL or a painful low back, could that be helped by breathing?
Yeah. So I want to be careful here because we're not sure that the QL pulls on enough ribs to really help with breathing, but we think it can inhibit breathing, right? And we do think that breathing helps to stretch it out because that whole kind of area expands there. I don't know if I answered your question. Can you elaborate a little bit?
Good question.
What?
I'm just wondering if breathing could help strengthen the abdominal muscles and then help lower back pain.
Oh, probably. Yeah. Yeah. The act of breathing itself actually probably strengthens, well, it does. It strengthens abdominal muscles and diaphragms and intercostals and all that stuff. And your abdominals, what Mr. McClure is heading towards, which I love, is your abdominals are intimately connected with your low back. Right? We always think, well, that's my tummy up here. What does that have to do with back here? Everything. Because there is no support up here. And so the abdominals are very much the thing that provides integrity in low back. If you go to any like exercise physiologist or something, you're like, I'm having back problems, one of the first things they're going to be doing is like, well, you need to start doing stomach crunches. But I said, my back hurts. Yeah, you need to start doing stomach crunches. Like that's one of the first things they do because of exactly what he's talking about. And so, yes, yeah, absolutely, sir. Yeah. And deep breathing could also help to stretch out all that fascia and then strengthen those muscles. And by the way, that's the holy grail for us, right? This is why massage therapists and physical therapists love being together, because many structural problems in the body can be solved by strengthening an area and loosening up, or loosening up some areas and strengthening others. But the point is, those two things they're non-invasive and they go very well together. Ms. Smith.
I kind of have more of a comment than a question.
Please, I like comments.
I just kind of saw, like, myself included, when you're, like, going through every single muscle involved in the movement, I like to think of robots. How the human body is so stinking complex that we can't even replicate it perfectly. Like, that's why robots have that, technical movement. Like, we're getting so close, but there's still not a robot that you see that can move as fluidly as we can, because our bodies are literally the most insane machines. So it's okay to be like daunted by the thought of like, oh my god, I don't understand how all these things incorporate with each other to create a movement, because the human species doesn't even really understand it yet. So it's just like, it's a lot, but it's supposed to be a lot.
Thank you, Miss Thing. Mr. McClure at the beginning of this asked me what I was grateful for, and I would like to add, I'm grateful for your comment. She really just nailed about 75 things with what she said, Miss Smith here did. For one thing, not everybody even understands how we breathe yet. So they're still studying this stuff, like how do you, when they know you do it sometimes, but when do you anchor this thing and use your pec minor to help breathe? And what do you do if you're using your arm during that time? And your brain works all this out. But they're still studying that stuff. So if you feel a little bit lost, it's because scientists are still lost. They're still discovering some muscles in the body occasionally. So there's a lot of stuff going on. We really don't understand the body at all. But I also love her explanation too about robots. Robots move kind of like the book teaches us about muscles. They tell you the bicep causes a flexion of the elbow. And it does. And robots move like that because scientists made them that way. Right? But your brain does the whole chain of stuff I just talked about, which is why you can do these beautiful kind of things. You know, that took, 50 different muscles and pulling on different things and anchoring stuff so that stuff would come to it, and then unanchoring it so it would come back to it and all that kind of stuff. So yeah, very, very, very well said. Yeah. But we care about this stuff. Even if you feel lost, we do care about it. You should care about it because these chains help you figure out things like you don't have a neck problem, you've got a back problem or a foot problem, and they're all connected. So, I just wanted you to realize there were other things beyond diaphragm number one. Diaphragm number one. Intercostals, internal, external, serratus posterior, superior, serratus posterior, inferior, number two, breathing muscles. And then there's lots of study that is not out there at all that shows that probably your pec minor and your upper iliocostalis muscles and things like that often help. And Ms. Stewart, you weren't off too on the pec major. There's some people that argue that too. That one's a little bit harder to prove for various reasons. It doesn't quite grab the ribs. It grabs the sternum. They're not quite sure. But it's not a crazy idea. And all the abs, right? Yes, they don't directly, they're not up here, but they affect the expansion and contract. They affect the contraction of your rib cage for sure. And Mr. McClure did a beautiful job of also pointing out the fact that all this ties into your low back. Right? And we know that muscles get tight. We're about to take a break, but we know that muscles get tight when they don't get enough oxygen. So here's why this becomes important when it comes just to stress relief. When I get stressed, all those muscles tend to tighten up, which means it's harder for me to breathe, which adds to my stress and lack of oxygen, which means all those muscles tighten up, which means it's harder for me to breathe, which adds to all my stress and lack of oxygen, which means all those muscles tighten up, right? That's really important. And we've learned about some other muscles that are very stress related that you guys work on all the time that can create a band around your back. So we've been, and I'm about to tell you about those. But I think I'll do it after this break. A little cliffhanger. This next part is extremely important. But you'll have to wait. So we'll be back at 10:24. Yeah? Cool. 10:24. All right. Thank you, everybody. We're excited. Yeah. Cool. All right. So I want to show you pictures in your book about this and just kind of highlight what we've done. But I hope that what we've done is we have kind of a theoretical understanding, a conceptual understanding, see how this can all be tied into other things, all that kind of stuff too. Before I show you pictures, though, I have one question for you. The diaphragm's job is to breathe, but could it be a structural muscle? Could it affect your structure? Yeah, don't overthink it. It attaches to the inside of your vertebrae, attaches to all your lower ribs, which are all hooked together. very much so. People that study fascial integrity to your body would 100% say the diaphragm has importance because a lot of what your body works off of is a principle called tensegrity. We haven't discussed this yet. We'll discuss it more down the road. But tensegrity means that I get a lot of structural support by kind of having it occasionally on purpose opposing forces. I'll give you an example. When you guys bend over to pick up a really heavy box, do you notice that you hold your breath? Well, you're supposed to, Miss Cuppage. She's like, no, let's pick it up. Throw it up my back. Normal people, I'm kidding because none of you are normal, including me. So, but most people, when they pick up something heavy, they hold their breath because they're actually pushing out on their internal abdominal walls. They're pushing out on their tummy from the inside. They're not just holding their breath, they're actually pushing it in. That's why they're holding their breath. At the same time that their transverse abdominis and probably their other abdominals, but definitely their transverse is pulling in. And what does that do? That creates a ring, a belt around your tummy to help support your lower back. It creates a weightlifting belt. It creates those back support belts. So you guys literally do this. You create tensegrity where you push out at the same time you're pulling in to create rigidity there so you can lift up the heavy box. You don't do that when you're trying to bend over and touch your toes. You want it to be loose in there. So tensegrity is really important, and the diaphragm definitely has a lot to do with like holding those ribs in and giving integrity to that and hooking into the low back. And so just, it's not just a breathing muscle. Yeah. And expanding the ribs, by the way, one of the best ways to try to stretch the diaphragm is really just to try to expand the ribs. Because the diaphragm's attached to them and you're not going to reach up there and just grab the diaphragm. You can kind of reach under the ribs, but you're not going to reach up and really massage the diaphragm. So let me show you some pictures here. Yes, Ms. Cuppage, please.
Okay, so there was a question that was attached to the video about the intercostalis, the intercostal muscles.
Yeah.
And it said, why would this need to be massaged or whatever?
Yeah.
Why would we want to?
Yeah.
You worded it in a way, but I'm not saying it correctly.
But why would you want to address? Why would you want to massage? What would be the point of massaging?
So why would you do that?
Yeah, why would you do that?
Well, I'm asking you.
I'm asking you. I don't ever massage them, but I figured if I asked the question, somebody would tell me a good reason. Why are we studying this?
Abby likes it when you massage your intercostal.
Okay, that's one good reason it could make you money. I love that reason, because we are here, we're here to love the world, but we're here to make a little money while we're doing it. Yeah.
I don't know. I mean, sometimes if you're, you've been, breathing hard a lot, that might be, I don't know.
Well, let me just ask this, Ms. Cuppage. What would happen if those muscles were tight?
But why would they be tight?
Well, one discussion at a time. But
and the question then.
But muscles get tight, right? We've kind of noticed that in lab occasionally, sometimes.
Yeah.
Okay. So since muscles kind of get tight, and since these are muscles, they could be tight. So what would happen if they were tight?
It'd be harder to breathe.
Oh, is that a problem? Is it a problem when it's hard to breathe?
Yes.
Okay. And by the way, does breath help the rest of your muscles loosen up, including the intercostals?
Yes.
So why would you massage the intercostals?
So you can breathe easier.
There you go. I told you knew. Yeah. Thank you. Yeah, you do it to help the ribs expand easier, so you can breathe easier. Yeah. And because Ms. Smith likes it. Honestly, that's a really good answer too. If your client likes it, they do it. But actually, it really does. It helps do that. So when I left you all, I said that there is some muscles that are, I don't know if I said all this, but I'm about to, that are associated with your shoulders and such, that when they're tight, they can make it hard for you to breathe too. These muscles don't necessarily help you breathe, although they can in a very weird way. But when they get tight, they can stop you from breathing well, and they're related to shoulder tension. And remember, when I'm tense, I'm anxious, right? And so if I'm tense and I'm having a hard time breathing, that makes everything worse. It feeds on itself. Do we have a muscle? By the way, in the book, you've been dealing with one muscle at a time. You're going to start to hear me talk about things as complexes. Because as Ms. Smith so beautifully pointed out, you're not robots, and you actually usually use chains of muscles to work together. Chains of muscles. You don't really move like, in these little pieces. We don't do that. We actually use chains running together. And we, human beings, came along, tore open a body, literally, with a knife, and said, oh, I'm going to cut this muscle out, and I'm going to call it such and such. And who do we learn that from? We learned that from the butcher. The butcher said, this is a rump roast. And so we went to people and went, hey, you cut out that same section, it's a gluteus maximus. But the gluteus maximus, by the way, feeds down to the IT band and does all this other stuff. So we might not want to eat the IT band, so we think about, I know we don't want to eat a gluteus maximus, but my point is we think about it like a butcher, and we segment this stuff that wasn't necessarily meant to be segmented. So, do we know a muscle that attaches kind of to the spinous processes here, runs into and attaches to the medial border of the scapula, continues under a different name, and inserts into the ribs? Listen to the way I said that, because it's probably more true than the way we taught it to you. Is there a muscle that attaches to the spine, inserts or attaches again to the medial border of the scapula, continues under a different name, and then inserts into the ribs? Just like when you're driving along a road and you're like, it's cactus. I love driving on cactus, right? What does cactus turn into? Thunderbird. Do I notice when it turns into Thunderbird? No. Somebody just decided to call it Thunderbird there. Same asphalt, same road. Whether you tell me to go on cactus or Thunderbird, they're both going to go to the same place if I go down long enough. What muscle complex am I talking about, Mr. Kachekian? What two muscles am I talking about? You are muted, sir.
Oh, serratus anterior.
That's one muscle. What two muscles am I talking about? Serratus anterior doesn't start at the spine. I mean, it kind of does. Under a different name.
No.
What? Could you speak up, sir?
I said rhomboids, but I said that was wrong.
Really? Okay. Since that's wrong, you're sure it's wrong, by the way, right? You're sure you're right about it being wrong?
No.
Okay. Why do you think it's wrong? Do the rhomboids start at the spinous processes here of the back and insert into the medial border of the scapula? So, does that have the potential to be right? Okay. Do you have a better answer in mind? I don't, by the way. I was just curious if you did.
No.
Let's go with rhomboids. Rhomboids was an excellent guess. The rhomboids literally insert here, and they hook to your scapula, and your book taught you something that's not true. It's a lie. Because they wanted to divide it up like a butcher and make it nice and simple. The rhomboids come in like this, at an angle, right? And if you look at a scapula, if you cut somebody open, you would see the serratus anterior, oh, this is terrible. The serratus anterior coming down like this at the same angle, wrapping around. You actually, if you can lift somebody's scapula like in a body, you just see it looks like this. The rhomboids are on one side, and this is on the, and this is all filled in fascia. They just decided that since they crossed under a bridge or over a landmark, that they're going to name them a new muscle. Right? And we do like to split them up because the rhomboids kind of pull the scapula this way and the serratus anterior pulls it this way. Rhomboids elevate and retract. Serratus anterior depress and protract. But they're the same road. We just named the road something different. And some people call it the rhomboserratus complex, the serratus rhombo complex. But here's the real point. You have a muscle or two muscles that are intimately connected, cannot be separated without a knife, that go from your spine all the way down to your ribs. How many of you get tight in your rhomboids? They pull back. Serratus anterior pulls forward. Could that create a cinching around your ribs? It can and it does. This isn't some far-fetched Tapscott fantasy. I've got some of those. I admit that I'm really stretching it. This happens all the time. So you'll have clients come in, they got really tight rhomboids, and I say, is it hard to take a deep breath? This happens all the time. Sometimes they breathe and they're like, nope. But at least half the time they go, yeah, it is. I didn't even notice. You didn't notice because you haven't been running. Why would you notice that? But it tells me, oh my gosh, your rhomboids and your serratus anterior are really tight. And, as Miss Cuppage, are you there? Miss Cuppage? Come back to me, please. Is that a garage door too? This house is amazing. Anyway, so the clients will quite often tell you that they're tight and they're having a hard time breathing, and you know the serratus anterior and the rhomboids are tight, and then you also know it is possible that the intercostals are tight, just because things tend to kind of all work that way together. And the fact is you've got a client who can't breathe well, which is the same problem, not exactly the same problem, but the same problem as a client that's not getting blood flow to an area because of a knot, right? We want to increase oxygen and blood flow, and they kind of go together. So this is somebody who's got tight shoulders, but they've got a tight rib cage. And their shoulders aren't going to get much looser. They can't take a full breath. Your job is to open that all up. So that's why all this stuff is important, right? And when you can take a full breath, as we all know when we get stressed out, it tends to make you feel better and you relax. So a lot of our game, by the way, is not always, as we started out this entire lecture on, you know, when Mr. Kachekian actually asked, can I help somebody where I can't rub this one spot, but I can work on all these other spots? And I said, absolutely. You don't usually need that one spot. Can I help a client's tension in their shoulders without necessarily really working on their shoulders? Absolutely. We discussed a whole emotional side that you can do, which we said was number one. It is number one. But we're also discussing you can help them breathe better because all that's locked up, and that can be half the problem too. And if you take care of half the problem, sometimes that takes care of the whole problem. Because once they can start breathing, then things get better, right? Like, so I'm not saying don't work on their shoulders, but I'm saying start to realize all this goes together. Yeah? Yeah. All right. Miss Cafiso, are you there too? Yes. Oh, I just don't get to see you? Is something I said? Okay. All right. Let me share these slides with you really briefly. Really briefly, because we've kind of covered all this.
Mr. Tapscott?
Yeah.
So in that system of tensegrity,
Yeah.
there will probably be multiple points where it's rigid or keeping the system locked up.
Yeah.
But if you find that one point and they're able to relax it or the multiple points, will you help the whole body?
Yeah, you should. You'll definitely help the whole body. The question is, will it be enough to unravel the problem? Do you know what I mean?
Yeah, that's
And usually it's not. But it is kind of like, sometimes I look at it kind of like when you're trying to untangle a knot in somebody's hair. You know how you can't get all the knot untangled? People with long hair will understand this. You can't get like the whole knot untangled in one area. You kind of get it loosened up enough to kind of go to the next area and loosen up, then you can go back to that area. And your body's very spider-webbed like that too. So yes, you would make some change to the whole system. That might help you go to other parts, make some change to that, and then come back to that part. Which is why some massage therapists very smartly work an area for a little while, move on, work on some other stuff, come back to it. Those of you that get 2-hour massages in clinic, which will be every single last one of you, I guarantee you, think about that. Just because you worked in a problem area doesn't mean you can't come back to it. They come in with back problems. People love it, by the way. They think you've really listened to them. Hey, my back's really bothering me. Can you pay extra attention to it? Do your regular massage, come back to their back and do some more stuff to it later. You've loosened up all this other stuff, And then they also know, like, oh my God, you really listen to me. Now you're doing something extra. Yeah. Okay. By the way, you can actually see the serratus posterior inferior back here in this picture right here. You can't see the superior because it's deeper and we're not there yet. But here we go. Here's serratus posterior inferior, serratus posterior superior. You see them going down to the ribs. You see them coming up here. So the stuff hooking down here. Transverse abdominis. You can easily see how that could pull your stomach in and help you contract your ribs. And here's the diaphragm. Now remember, it's hollow on the inside. It's an umbrella on the inside. It's an umbrella. You could put your fist up underneath it if somebody was dead and didn't have organs underneath. But you could put your fist up underneath here, no problem. No problem whatsoever. So it is an umbrella here. You're seeing the outside of the umbrella. And this is where I don't like origin insertion discussion, because your book wanted to stick with origins and insertions. Remember, I'm really into just calling it all attachments. What this thing really does is have attachments all around the inside of your rib cage and your back here, including your lumbar, right? So this could have, the breathing could affect your low back issues. It says that it inserts in a central tendon, and it's just a way to describe it, but the reason they care about this central tendon is the top of this muscle is kind of tendinous, and that's what hooks to the sac that's around your lungs. So when the muscle contracts and the umbrella collapses, that central tendon pulls down that sac and creates a vacuum. I don't care that you really think about it that way. I just want you to realize this muscle hooks to the inside of all these ribs down here, right? All your lower 6 ribs, which is a lot, and your inner lower back. So that's what's really important about it. I mean, it's important that you breathe. But my point is, from you understanding where it's attached to the entire inside of the barrel that you call your rib cage. It's attached all the way around that barrel. Yeah? This is looking up underneath it. This is if you were laying on the ground. I don't mean this in a weird way. If you're laying on the ground and looking up between your client's legs and they didn't have a lower body and you're able to look underneath it, this is the underneath of the umbrella. This is if you looked up on a day that was rainy and you had an umbrella underneath you. This is the inside of the umbrella. You can see how this thing attaches to the low back. What's this stuff that runs right next to it? This is your quadratus lumborum. That has a lot to do with low back stuff. This guy is actually even sewn into some of the fascia there. Hooks into the entire rib cage. You've got some important holes, by the way, in this umbrella, because otherwise you couldn't swallow food if it couldn't come through this hole right here. So it's called the esophageal because your esophagus comes through it, which is how you swallow food. Hiatus. Hiatus just means away. Like I went on hiatus when I went on my vacation. Same thing. So the muscle's on hiatus here. There's no muscle here, and they call this the esophageal hiatus. There's no muscle here, so the esophagus can come through there. The vena cava is your main vein. It's returning all the oxygen, poor blood from your lower body back up to your heart. It comes right through here. And this is your abdominal aorta. This is where all the blood from your heart comes down to feed your lower body. So there are some holes in here that are really important. But that doesn't affect you directly. I'm just kind of pointing out what's in the book there. You can affect the diaphragm by affecting the ribs. Don't be afraid to grab onto somebody's ribs and try to manipulate them. Do it nice, check in with them, but you can grab onto the ribs. There's nothing wrong with that. You can press on the ribs. You can move them. They're quite flexible on most people. You want them to be flexible. Here's a picture of the intercostals. Internal and external intercostals, that's what they're trying to show you, but you guys won't feel the difference. They're just all the rib meat. But this picture here of the fingers here kind of shows you the internal, external intercostals, but they're all between the ribs. Your book makes their origins and insertions really, really tricky. It says, oh gosh, the origin is the inferior border of the rib above and the superior border of the rib below. What? What does that mean? It's just the meat between the ribs. But what they're saying is they hook to the lower border of the thing above it. Well, of course they do. The thing above its lower border it hooks to. The thing below it, it hooks to the upper border of that. They're trying to really just say, this thing hooks to the bottom of the rib above it and the top of the rib below it. Do not worry about that. Take that out of your head for the rest of your life. And just be like, intercostals, those are rib meat. Find them between the ribs. Because practically speaking, that is really, 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 really accurate. You do not need to get all fancy and name them. They attach all your ribs together. I think it's ridiculous the way your book puts it. There's your serratus posterior, superior, and inferior. This is on the back side, posterior, right? Superior one helps you lift your ribs up when you inhale to elevate them. Inferior helps to depress them, pull them back down. Serratus posterior ones essentially, there we go. Essentially attach to your upper lumbar here and go to your first 4 ribs, that last 4 ribs, I apologize. 10, 11, and 12. The upper ones in certain like ribs 2 through 5. Both hook onto 4 sets of ribs, upper and lower, and help to move them. They are very deep muscles. It is unlikely you will feel them, although you might feel knots in them and not be sure. Like up here, you might not be sure if you're feeling a knot in the rhomboid or the serratus posterior. And don't call me over to ask which one it is because I won't be able to feel the difference either. I'll just be like, yeah, there's something wrong there and you should rub that out. It's very hard. They're very deep. They're under a lot of fascia at this point. There's so much thoracolumbar aponeuroses down in the lower back, it's very hard to feel. Ms. Cuppage, please.
Is that part of the rib meat too? Like if you're eating ribs, is
No.
that part of the...
No.
No?
No, the rib meat really is just the intercostals.
Okay.
I mean, unless the butcher did a bad job or something, but no, rib meat is just, it's just intercostals. And I don't know if, I mean, other animals have serratus posterior muscles, but I don't know what those are from an eating point of view. Like, I don't know, you know. So, anyway. They might be so thin that they don't really do much with them except grind them up or something. Not to get all morbid about it. But anyway. This person is just showing you where they'd roughly be hand-wise. But again, they're very hard to feel. Sometimes when the ribs are moving around, you can feel something moving around under there, and you can surmise that that's what it is. But it's under many, many layers of muscle. And that is it. That's it. Those are the breathing muscles and ways to think about breathing, and to realize breathing is important to relaxing clients, and breath is life, and to realize that breathing muscles are also structural support muscles, and to realize, gosh, I better start really paying attention to anatomy because things are about to take off here. Yes, they are. So, and I will tell you there's a big difference between a therapist that really knows their anatomy and a therapist that doesn't. And that difference can be about $20 an hour. You thought I was going to say something profound, right? No, money. I mean, plus the satisfaction knowing you're really, really good and keeping your clients. But, you know, a therapist doesn't know their anatomy really well, but does a decent back rub, can get a job. I promise I'll get you all jobs. But you might be making, I don't know, $20 an hour plus tips. If you're really good at your anatomy, you might be making $40, $50, $60 an hour plus tips. And it's a lot nicer to live in a world where you make $100 an hour when you walk out from your massage as opposed to $40 an hour or $30 an hour. If you do the math there, you have to do a whole lot less massage if you get paid a lot more for it too, which is kind of cool too. And people figure out really, really quickly who are good therapists because they get better. And those therapists tend to know how to apply their anatomy. So think about that when you're studying. You're like, I don't want to do this. I just want to get through it. Pay attention to the anatomy stuff. Really try to think about it. Okay, everybody, I've released 3 homework assignments. They're all fairly small. One you're going to see isn't due till Tuesday because it was going to be kind of discussed on Monday, but Monday we're going to go to the board meeting. So the stuff, 2 of those assignments are due Monday, 1's due Tuesday. You might as well do them all before then. But anyway, but if you see a discrepancy, that's why it's there. It's because I thought you didn't want me to just surprise you with homework on Monday. So I'm not going to be releasing any homework Monday. It's all been released. So Monday, we'll do gratitude. You'll all come to this lecture just like normal. You'll look at this guy just like normal. And this guy will do gratitude with you just like normal. And then I'll be like, go to this link and watch the board meeting. And if the board meeting finishes, if the board meeting's not done by 11, which it probably won't be, at 11 o'clock, you're just going to log off and go to lab. Don't say goodbye, Mr. Tapscott, on the board meeting. Please, for the love of God, don't. Do not. You can have your cameras off on the board meeting. I'm going to trust you're watching it. You might not be, whatever. Have your cameras off, have your mics off on the board meeting, and just watch. And we'll talk about it, another time. But there are 3 very interesting cases on the board meeting. And I'll say this again on Monday, but also just to let you know, some of the cases are very upsetting, and they might be very triggering. And I am 100% okay. There will be somebody on this meeting still, like Mr. Ibarra or Miss Bauer. And if you find the meeting upsetting and don't want to listen to it, because there's 2 cases where clients were violated. If you find that upsetting or whatever, if you think it's going to be upsetting at all, you don't even have to go to the meeting. You can stay here and somebody will do a review with you. You don't need to explain to us why you're here. You can just be like, I don't want to go. You don't even have to tell us. The point is, you can go to the meeting, drop out, and come back here. You can stay here. Please don't feel like you have to go to the meeting. You have options, right? So, because I think it's sometimes really hard to hear about other people's trauma. But they are interesting meetings. The reason I want you guys to go to them is there's a case where a therapist violated their client, a licensed massage therapist violated their client. There's a case where a therapist that didn't have a license pretended to be a therapist and violated their client. One of the first times I've seen that. And there's a case where a therapist went too deep on a client, and we rarely see that, and it looked really interesting to me. By the way, they went too deep on a client, and the client told him to back off. And it seemed to cause them problems. I'm not talking about just regularly going too deep. They seemed to really go to town on this client. The client said that's too much. They just told him to breathe through it, and the client had some problems. So I'm not sure where those cases are going to go, by the way. I personally have made decisions in some of the more serious ones, to be honest with you. But anyway, they're worth hearing about. And I think it's very good to understand how things look different when you're in front of a board and you have to say them in black and white. I think a lot of people, question that. I often ask myself as a teacher when I'm doing something, how would this sound if I had to explain it to the board? How would it sound if I said, yeah, I cut so-and-so slack, but here's why. Would I feel comfortable saying that in a room with an audience? If the answer is yes, then I do it. But if I'm like, oh, that doesn't sound so good in black and white. I'll give you a funny little example. I was at the Princess, and I was the treatment manager there for the spa there. And so I did all the interviews for new therapists coming in. And we couldn't do them during the day because the spa was too busy. Sometimes we did, but we normally couldn't. The spa was too busy. So we do them after the spa, close at night. We have people come in, they interview, and they do a massage on you. And a person did a massage on me, and security was just doing a nightly check, and they opened the room door, because the room doors don't have locks on them. And they saw I was getting a massage, and they closed the door. And they filled out a security report, because they did find somebody in the spa, right? They're just going to fill out a security report. Well, the security report, it's in black and white. This is where reality in black and white starts to change. The security report said, found Mr. Tapscott in a room naked with a non-employee. Now, that's 100% true. I did not get in trouble. They realized exactly what was going on. But that's how stuff sounds in black and white, or when you have to get up in front of a group and somebody questions you and says, I hear that's true, but were you there doing X, Y, Z? And they're like, oh, yeah. But, got that. But were you there? That's why it's kind of good to see board meetings, because things sometimes sound very different. It's good for you guys to realize, I don't want you to be scared, but I want you to realize, like, whenever you're in a room and you're kind of questioning whether to do something, how would this sound if I had to explain it to a group of people that didn't know me? It's really good. You all should be able to see your homework already. Please tell me if you can't. All that good stuff.